8 warning signs of low oxygen in your blood. When you breathe in through your lungs, you absorb oxygen to keep yourself alive. Oxygen enters your red blood cells, erythrocytes, and is circulated throughout your body to your internal organs, tissues, cells, and muscles. The advantage of oxygen cannot be overemphasized as it allows all of your cells to produce energy. Unfortunately, many people have low blood oxygen levels, which can cause long-term damage to the cells in their heart, liver, and brain. But what causes low blood oxygen levels to begin with? A chronic lung illness such as asthma, bronchitis, emphysema, COPD, or pneumonia can cause low oxygen in the blood. Smoking cigarettes can cause hemoglobin to be locked up, reducing the oxygen storage capacity in your blood. In a panic attack, high amounts of the stress hormone called cortisol can cause you to hyperventilate and lose the balance of oxygen and carbon dioxide in your blood. Snoring and sleep apnea can also cause oxygen levels to drop in the body, in addition to eating too much sugar, causing the blood to become more acidic and lowering oxygen levels, along with a lack of key minerals, which might result in anemia or low antioxidant levels. Low amounts of oxygen in your blood can cause hypoxia and serious harm to your internal organs if left untreated. In this video, we'll look at 8 warning signs and symptoms that your blood oxygen levels are low. Just a reminder that this video is for educational reasons only. If you have any medical concerns, please see your doctor. Number 8. Shortness of breath. Shortness of breath is one of the most prominent warning indicators of low oxygen levels in the blood. It is defined as the sensation of gasping for air or straining to breathe. Shortness of breath explains difficulty during breathing and the sense that you can't take a full breath. This happens when the body isn't getting enough oxygen. When blood oxygen levels are low, the body's cells and tissues do not obtain the oxygen they require to operate correctly. This can occur for several causes, including lung illness, heart problems, or high altitude. If this is the case, your doctor may advise you to try oxygen treatment, which involves breathing in oxygen through a mask or nasal cannula. Deep breathing exercises can also assist in boosting the quantity of oxygen in the blood. Techniques such as diaphragmatic breathing and pursed lip breathing can be very beneficial. However, it is preferable to begin performing them only with medical supervision. So ask your healthcare practitioner if they can assist you in your situation. Number 7. Increased heart rate. A healthy person's heart rate ranges between 60 and 100 beats per minute. You may count them by placing 2 fingers on your wrist and counting. If your heart rate is greater than this when resting, or if you hear your heartbeat while lying down in bed, this might suggest that your blood is low on oxygen, causing your heart to work harder to pump more blood through the body. When your blood contains a low oxygen level, your circulatory system adjusts to send more blood to tissues to compensate for the reduced oxygen delivery, which is detected by oxygen-sensing systems such as carotid bodies. The immediate central cardiovascular response to hypoxic stress causes an increase in heart rate while maintaining stroke volume, which is predominantly mediated by increased sympathetic neural discharge as hypoxia severity increases. Lower degrees of hypoxic exposure may result in some degree of systemic vasodilation at rest. However, as hypoxia severity increases, the peripheral vasculature constricts to shift oxygen supply to the most critically reliant organs, such as the heart and brain. But don't worry, we have the solution to this later in the video. Number 6. Headaches. When your body is not receiving enough oxygen, your brain may not be able to function properly, which can also cause headaches. Headaches like this are usually dull and persistent and may worsen with physical activity. Also, chronic hypoxemia or low oxygen level can cause damage to neurons and their connections, further impairing synaptic plasticity and cognitive function. Similarly, if you get up or conduct a mild exercise like walking and feel dizzy or weak, you may have low oxygen levels in your blood. You may feel unbalanced and see your eyesight blacking out momentarily, particularly around the periphery. This indicates that oxygen isn't getting to your muscles as it should, resulting in weakness. Number 5. Confusion. When the brain does not receive enough oxygen, it may not operate correctly, resulting in confusion. If your brain does not receive enough oxygen, you will frequently feel confused, sluggish, fatigued, and annoyed. This is frequently caused by a deficit in vitamin B1 or thiamine, which causes nerve and cell damage in your brain and is commonly triggered by consuming too much sugar or processed carbs. You can feel disoriented or have difficulty thinking properly. The brain requires oxygen to meet its energy needs and to perform essential tasks, including neurotransmission, synaptic plasticity, and protein synthesis. For example, synaptic plasticity refers to the capacity of synapses, the connectors between neurons, to alter and adapt in response to inputs. This is an important process that underpins learning and memory. Our brain's synapses adapt to strengthen particular connections, much like when we acquire a new ability. This enables us to adapt to new conditions and learn from our mistakes. And it all depends on oxygen. A shortage of oxygen reduces synaptic plasticity by interfering with neuronal energy metabolism. Neurons may be unable to make enough adenosine triphosphate, the chemical that supplies energy for cellular functions, if oxygen levels are low. This causes a reduction in synaptic plasticity as well as learning and memory problems. Confusion may now be an indication of a variety of health issues, including infections, electrolyte imbalances, and neurological abnormalities. Confusion, conversely, can indicate low oxygen levels in the blood, especially if other symptoms are present. Low oxygen levels hinder the brain's capacity to create energy and complete key metabolic activities required for optimal brain function. See your doctor for a fast checkup if you notice any of these symptoms. An oximeter will be used to monitor your blood oxygen levels. A typical reading is roughly more than 95%, but if it is less than that, especially less than 92%, there is an underlying issue. Number 4. Nail color changes. When your nails appear blue, it could indicate low oxygen levels in your blood. However, this is usually a symptom of an underlying condition rather than a condition itself. Pale nails occur when there is insufficient oxygen in the blood, which can happen if the blood is not carrying enough oxygen to the fingertips or if a person has poor circulation. These vessels narrow to prevent blood from reaching the extremities and keep internal organs at the optimal temperature. However, if the cause is a low temperature, the normal nail color should return when the person warms their hands. If pale nails do not result from a low temperature and the hue continues, seek medical treatment. Receiving therapy as soon as possible should reduce the chance of problems and enhance the person's results. It could also result from problems associated with hemoglobin, a protein in the red blood cells responsible for oxygen transportation. Various health conditions that impact the respiratory and cardiovascular systems can also lower oxygen levels in the blood, leading to pale or blue nails. While this can cause some worry, you can remain calm, because we have a solution to prevent this from happening. Number 3. Venous insufficiency or heavy legs. If you become out of breath easily when climbing stairs or walking up a little slope, you're most likely deficient in oxygen in your blood. The heart sends oxygen-rich blood to the rest of the body via the arteries, while the veins return deoxygenated blood to the heart. When a person suffers from venous insufficiency, their veins have difficulty returning deoxygenated blood from the arms and legs to the heart. Faulty valves inside the veins mainly cause venous insufficiency. Veins feature valves made up of 2 flaps that prevent blood from flowing backward. These are known as bicuspid valves. The valves may fail to seal correctly if the veins are injured or dilated. When the valves fail to function correctly, blood flows back into the veins rather than forward to the heart. This causes blood to pool in veins, particularly in the legs and feet. A lot of symptoms associated with venous insufficiency, such as skin discoloration, swelling, and discomfort, originate from this. Because insufficient oxygen is reaching the muscles, your thighs and calves may feel heavy, or you may have a weaker heart due to inadequate fitness. A lack of vitamin C or E frequently causes this condition. The optimal therapy for chronic venous insufficiency can differ depending on the individual. Before deciding on the appropriate treatment plan, doctors must examine several criteria. Number 2, coughing or wheezing. Most long-term lung problems worsen progressively over time. Feeling progressively out of breath is the most typical symptom. Some people's breathing problems may worsen considerably faster, spanning weeks or months. This is especially true in the case of interstitial lung disorders. Breathing gets considerably poorer for patients in the terminal stages of a lung ailment. Their lung function does not fully recover after each flare-up or exacerbation, and breathing becomes more difficult. As long-term lung disease progresses, your lungs become less efficient. Any effort, even shifting your posture, chatting or eating, might cause you to feel short of breath. Because lying flat might make breathing difficult, consider sleeping slightly upright. Low amounts of oxygen in the blood may come from impaired lung function. This might result in painful fluid retention in your legs and belly. Flare-ups typically lower the oxygen in your blood, exacerbating your symptoms. If your symptoms seem to worsen over time, kindly see your doctor. Number 1. Blue tinge to skin or cyanosis. Sometimes a bluish color or tint may appear on your skin or lips, known as cyanosis. This happens when your body tissues do not receive enough oxygen. Cyanosis can occur suddenly and is usually accompanied by shortness of breath. Red blood cells are responsible for providing oxygen to the body's tissues. Normally, almost all the red blood cells in the arteries have a full oxygen supply, making them bright red and the skin pinkish or red. However, when blood loses its oxygen, it turns dark bluish red, resulting in a bluish tinge on the skin of people with low oxygen levels. Cyanosis can develop suddenly with other symptoms, depending on the cause. When caused by long-term heart or lung issues, it may develop slowly with mild symptoms. Detecting cyanosis can be difficult when the oxygen level drops only slightly. In dark-skinned individuals, it may be more noticeable in the mucous membranes, such as the lips, gums, around the eyes and nails. Now let's take a look at 6 simple lifestyle tips that you can use to boost your oxygen levels. Number 1. Consume meals high in heme iron, which is iron bonded to animal proteins found in oily fish, shellfish, and high-grade grass-fed cattle and liver. These meals also include vitamin B12, which combines with iron to boost red blood cells, allowing more oxygen to be stored and transported via the blood. Number 2. Limit processed carbs such as sugar, soda, and refined grains such as flour, bread, wheat, pasta, pancakes, and biscuits. These deplete your antioxidants and can cause your blood to become acidic, resulting in low oxygen levels. Number 3. Eat foods high in vitamin E such as sunflower seeds, avocados, extra virgin olive oil, hazelnuts, Swiss chard, and all leafy green vegetables to enhance heart function and raise oxygen levels. Tocotrienols are a potent supplementary form of vitamin E that can be taken if desired. Number 4. Take lengthy, gentle walks around locations with a lot of trees and plant life. Aim for at least 30 minutes of exercise every day. Gentle movement, fresh air, and essential oils emitted by trees all assist to increase circulation and oxygenate the blood. Number 5. Consume low glycemic berries strong in antioxidants and resveratrol on a regular basis, such as blueberries, strawberries, gooseberries, and acai berries to increase oxygen levels. You should also drink at least 1 liter of mineral water every day to hydrate your body and thin your blood, which will aid in the flow of oxygen throughout your body. In the morning, mash 3 tablespoons of berries, 1/4 teaspoon of Celtic or Himalayan salt, and 16 ounces of carbonated mineral water to prepare a delightful and healthy drink that will increase your blood oxygen and electrolytes. Number 6. Finally, you can practice abdo-diaphragmatic breathing. Put one hand on your tummy and the other on your chest. Breathe deeply and gently to a count of 4 into your abdomen while maintaining your chest motionless. Then exhale gently to a count of 6. This improves the distribution of oxygen into your lungs while also calming the stress hormone cortisol, causing serenity and relaxation. If you have made it this far, comment down below with the word oxygen to confirm that you have received the knowledge from this video. For more interesting topics, make sure you watch the recommended video that you see on the screen right now. Thanks for watching.